Hi back guys. Hopefully this time much better. Sorry again for the delay. It's something wasn't really planned for. It sometimes happens when you want to do something in perfect way. You may find it's really hard to do it this way or the good way, which is like sudden changes. Maybe it's Facebook settings. We haven't been aware about it, but now I believe everything's fine. Please guys confirm that everything's fine, because again I'm wondering if there is the video's upside down or not. Again guys, sorry, I'm gonna give you about like 2-3 minutes until be sure like everyone is online, and after this we're gonna start our session. Okay. Seems like in my computer now I can see the videos. Somehow it's good. Yep. Seems like Rashmish is saying it's all good. Most of you guys saying all good. Sorry guys for the delay again. Sometimes things happen and you don't have any control on it, as we don't have a control in Facebook itself, the settings, which is weird. So only 1 minute left guys, and then we can start with our session. Let me first wish you all the best before starting any question and answers. We knew very well now, most of you are stressed because it's a new system coming, especially with OSCE. So if you have done the exam before, and expect most of the people who go on the exam this time, they have done the exam before. So they know very well about technical, but the problem now it's more about OSCE itself, which I hope it shouldn't be a problem at all for any one of you. Okay guys, so as I said, this session's mainly it's for question and answers. So I will be very happy to answer your questions. So whatever question you have in your head, and I have answer to it, because definitely I don't have answer for everything. So, but whatever I can answer you, I will answer. If I cannot answer, I cannot answer. So hopefully today we're gonna cover as much as I can in 1 hour time. I know, like I always say, 1 hour and extend it even more than 1 hour. But I wish to be only 1 hour because I want to go and sleep. Okay guys, so I'm waiting for your question now. Please, you can start ask questions now, please guys. So if you have any question, you find it really it's confusing and it may help you, so please guys, just answer it. Again, Mahmoud Al-Wakil, I can see there was a question from Mahmoud Al-Wakil about the clusters and the assessment actually. So okay, I don't know Mahmoud if you have the assessment page with you or not. The one has a cluster in it. Look again, ADC, when they put any system for assessment, actually they make it a little bit vague and not clear, because they're only people they can say like who gonna pass, who's not. We understand like in ADC they work with quotas. Most of the university in Australia, quotas mean the only best people gonna pass the exam. Even if you pass the exam, in the sense of you already have done like good in every task, but there is few people get better marks than you. They choose this few people, not you, even if you pass the passing mark. So if you go to page number 22 out of 24, and there's one example in passing candidates, that is number 7.3.1 page. This is, I would say, the assessment criteria handbook. So again, page number 22 for the cluster page, because that's now answering question for Mahmoud now. So again, page number 22 out of 24. Example 1, passing candidates. If you look at the clinical skills days, which is the one making you confused, you can see you have like 10 stations. In 10 stations, the example saying there's one person, he failed like 2 stations and he passed the rest. If you look at cluster 1, you'll find in cluster 1, this person had, however, he actually passed the exam. That's because he got good result. When you gather the 2 information together from station 1 and station 2. So my understanding here is, if you go to OSCE format station based, the one which is page number 14, I think the same guideline, same handbook. Page number 14 out of 24, so seems like the same handbook. You will find that OSCE format station based on 10 stations, 2 clinical information gathering, 2 diagnosis and management planning. So now you have 4. 2 clinical information gathering, and this is 2 clinical information gathering they're going to consider as 1 OSCE, not 2 OSCEs. So if you have done good in both of them, you're going to pass. If you have done or you will do good in one of them, and this one you have really done like a very good in it, and the other one which you just only failed, but your marks is still high fail, so the one which is very good grade will help you with other task, with other station, so both together are gonna be pass. So they consider now the 2 clinical information gathering as 1 OSCE. So you must do good in both of them. So that is a cluster 1. Cluster 2. The cluster combines the scores from post-diagnosis and management planning station. Same things exactly. So they're gonna make for cluster 2 diagnosis, management and management planning. So they post together, they're gonna work together as 1 station as well. So you have to score in both of them. If you gather the 2 marking together, you have to pass both of them. So you may fail in one and pass of one, but again your pass grade is really very high that it may compensate the fail. Okay, cluster 3, fail. Actually shouldn't be fail, it shouldn't be pass. And actually I knew like Asana, she emailed the ADC, and ADC they actually correct it now, which is cluster 3, and they make it pass. So this cluster combines the scores from all clinical treatment and evaluation, which is the 6 of them. So understanding now, they're making the 2 clinical information gathering and 2 of them as 1 OSCE, the 2 diagnosis and the management planning, the assessment gonna be like 1 OSCE, and the 6 clinical treatment and evaluation, they make it all together as 1 OSCE as well. So you have to get good scores in every one of them, but if you fail in one, maybe you go to score in the rest, make you pass the whole cluster. Okay, cluster 4. Pass. This cluster combines the scores given for effective communication across multiple stations. We understand in the old system, actually the previous system, not the old system, they used to examine you actually in 2 separate tasks. One is called communication, and the other one is called infection control. So cluster 4 and class 5 telling you, you must pass the infection control in all the stations, and you must pass the communication task or communication skills in over all stations. I think now it's like understandable now about cluster 1, 2, 3, and 4, and 5. If you have any confusion, please ask me again. Guys, is the video running well? Live video interrupted. Guys, can you see? Please guys say yes or no, because it does say live video interrupted here. Please, I need someone, please guys, just try to, maybe the internet connection from your side, I don't know. No, I think my video is fine here.
That's it.
Okay guys, just... it's fine, because Shaheen Khanchi was saying it's interrupted or paused, but now I think it's fine. No good, okay, no worries guys. Okay. No post. Okay. So, guys, that's all about the cluster criteria. Guys, if it's pausing, I think that's maybe because internet connection, either from side or our side. Okay, guys. So I'm taking now more questions. So please, Mahmoud, if you're still confused about any of this criteria, please let me know. Guys, sorry guys, I cannot answer any specific question for the Academy itself in here. Please, if you want to ask any question according to the Academy or the course or anything else, please text on the text the Academy on the Facebook page, please. Inbox them and they can tell you all the information. So, sorry guys, I cannot answer any question related to the Academy, please. Okay? Yes, actually, Mahmoud, yes, it will be applied as well for technical. So infection control must be applied in technical and must be applied in clinical, both of them, not only on technical, not only in clinical. By the way, guys, my experience with ADC normally is in the beginning in your system, as it happens, you will find that there may be a little bit of confusion and a little bit of insufficient information, but after some time they work on it and they provide you with more information and guidelines to follow. How important is onlay? Yes, definitely onlay is very important. But if you're asking about the technical exam, I don't think really they're gonna make onlay as one of the first tasks in the exam, and hopefully not. Which is an easy preparation anyway. It's not hard. Technical task has build up composite. Definitely, you may get built up because that's one of the old system. I remember, like before 2013, or before the previous system in 2013, 2014. Actually, they used to to bring one of the tasks. Actually, it was the composite build-up, and it was mainly premolars. So if you want to practice, you can practice. Like, let's say, try to be ready for any task. You cannot just expect, guys, you are a dentist, so don't expect only they're gonna give you some specific tasks, which is gonna be too hard. Like just imagine, like if you get a patient with cusp capping and say, sorry, I'm only specialized in class 2 composite restoration. I cannot do the cusp capping, which is gonna be weird. So pay attention more to the tasks that they mention in the guidelines. Like let's say 80 to 90% on this task, but at least you have to have some ideas about the rest of the task or rest of restorations. Amita, that is very correct. It's important to read about the ADA journals for communication, definitely. Australian Dental Association journals, it's very important because every country, guys, has its own way of, let's say, skills, behavior, management, and the culture. So when you talk to someone coming from Africa, it's different than to talk to someone coming from Asia, different than someone who's in Australia. So the best way to understand about Australian people is to read from Australian sources, which is mainly ADA, the Australian Dental Association journals. That's really going to help you. Okay, Samir asking about restoration section for composite. Could be class 4 or 2 or both. Actually, the word approximal or approximal, it means it could be class 2, it could be class 4, it could be class 3 even. Any one of them can come in the exam, but mainly we understand that the caries simulated teeth, the one dental have right now, it's either molars for class 2 or anterior for class 4. So anyone may come in the exam, but I would say class 2 is more important than class 4. But could be both of them come in the exam. There is a question now from Samir, actually. Which task could be there as clinical treatment and evaluation? It's too hard, Samir, really, to expect only one task. But for clinical management and evaluation, it's the same basic, same principle. If you apply it to any case, it will work the same. But you need to understand about like caries. I'm sure caries, the exam must have something about caries. Must be either someone who has rampant caries. It could be someone, you need to evaluate the caries risk for this patient. Maybe management of the caries itself, how to manage it. Perio case, the perio as well, like it's gonna be one caries, one perio case. Perio, they may give you a chart and then ask you about to diagnose it and evaluate the patient according to the perio chart. By the way, you need to pay attention to the previous communication task they give it to you before, because they may change these tasks into real stations scenarios. So please guys pay attention to this type of communication. Previous communication tasks has been provided by the ADC in the last few years, because again, as I said, like, could be important actually to go through them. They may use any of them in your exam, and we used to see that from ADC. They used for part 1, for example, they used to give like exact question from the handbook in the exam, so they can do the same. And actually they do this to help you. So please go and read the 4 tasks as a communication task. Especially they gave you one of them as an example, so it means they may use them. Again, if you ask about the clinical management cases, I would say caries should be there. Perio cases should be there as well. Management with patient, let's say with emergency case, how to manage this case in your clinic, that's important. I would say cases, patient with abscess, patient with trauma. So think about whatever is regular cases you may need to treat in clinic every day, the regular and the common. Please guys, don't go and read something which is very special or very particular in dentistry, because that will not help you. And my advice for you when you manage a case, don't be very smart. In Australia, they don't like smart people. They like only to follow the law and rules. They must understand what you're doing. So if you are a specialist in your home country, please guys, don't use the information in your home country as a specialist when you manage a case. Just only manage it as GP, as general dentist, but not as a specialist. Otherwise, they don't like you at all here. Heba, she asking a question. What are the excluded tasks from the previous handbook and technical tasks? Look, Heba, from ADC, my experience with ADC, don't trust them very much, because like you have seen by yourself, the people before, they have expecting to get the temporary crown on pre-prepared tooth, and finally they ask them to do the temporary crown on the tooth they have prepared actually for for a crown for PFM. They have, yes, they have really neglected this task or actually cancel it without consider them during the whole assessment procedure, but still, like, they can't do anything. And if you go back to the handbook, they said this task could be, but not restricted to, so they can get whatever they want. But again, pay attention to only 6 tasks they provide you for now, and try, if you ask about FGC, especially, I would say you still ready to practice FGC. As I'm advising everyone here in the Academy, actually, you can start the crown cut as FGC crown cut, and then you can change it from FGC to PFM. What you need only to do is just increase the finish line and axis reduction from the buccal wall, and increase the occlusal reduction about 0.5 from the occlusal wall. And now it's become PFM. So start as FGC. Start with the buccal, the 2 axial, which is proximal, and the lingual and occlusal, all of it as FGC, and then change FGC to PFM by only reducing more on the buccal and occlusal. Afro's actually saying, while making provisional crown, when I use Vaseline, it gets very dirty. And just one second, because it gets very dirty and sticky. Previously, we were using alcohol swabs to clean them. Now, there is no mention of alcohol wipes. Okay, wipes. Can we use the non-alcoholic wipes supplied in the station to wipe the provisional crown? Actually, alcohol is very important in temporary crown, because that's removing the oxidized layer on the top of the temporary crown, which is really good. It's helping. But believe me, it's once you finish it properly, just with desks, so they provide you desks. So once you finish it properly and try to smooth it with Soflex desk, I think that will be enough. For Vaseline mainly not to make a shine in it. Vaseline mainly it's just to help you to take it out from the apartment tooth, and doesn't stick there. They don't even, my information so far, maybe they updated the last few days, my information so far, I would say they didn't even provide Vaseline so far. I know if they added or not, but they should add something which is lubricant, not only for temporary crown, for rest of other technical tasks as well. So you don't have now Vaseline, you don't have alcohol wipe. You are now in, what does it say in business? Does it say I can't remember the word, but you are equal now. All of you guys are equal. You have the same chance now. You have the same base, you have the same materials, using everything's the same. So it's just only gonna be a little bit different between of you. So smart people, they know how to do good polishing using the Soflex and using the other materials they're giving to you. I think that this will gonna pass. If you wanna use alcohol wipes, there is no alcohol wipe. The non-alcoholic one, just use it and try it. But I don't think it really make difference if you use it or not. Okay, we're all asking about any format we should follow for removal by shade denture designing. Will it be on cast or paper? Is it marked in different colors, etc.? So, my experience, guys, I'm not quite sure, honestly, gonna cast or not, but my experience, they used paper sheet. And paper sheet, they give you paper sheet, giving you both, actually, cast and paper. So the cast, at least to know like which case it is, and the paper to write down your write down your notes, like your designing, your components, your justification. Why do you like this design rather than the rest? Because for one case you may have more than one. You may have more than one design, but you need to justify why do you do this. Okay? Yes, you need to use different colors, and you need to mention like which component has different colors. I like really to do different colors with every component according to the function. Like whatever for support, I make it different. I make it one color. Whatever for retention, I make it one color. Measure connector should be different color, and so on. They haven't given any finishing burs in the kit. No, actually there is one carbide finishing burr, which really I don't like it that much. I used to use burr finishing burr. Like if you're asking me about a finishing burr, I would say yes, there is one, but it's not as good. The finishing burr, which is carbide, it's which is similar to the NZ burr, but thinner than NZ burr. That's the only one you can use it. Otherwise, you have a red band. Otherwise, you have the red band Foodie Bear. It is really big, like it's 18, I think, 18, maybe 23. Like it really something was very big. I don't like it. I like pointy, but that's what you have right now. So you have to work on them. Again, you have equal chance now, which it's like equilibrium. Everyone has most of information. Equal information right now, equal materials, equal birds. So it's all now about your skills and how to develop your skills according to whatever information you have, or whatever materials, or whatever instrument and tools you have. What are your advices for dental students planning to do ADC exam after graduation? It's a long story. I think you need special session for you, Leith. Please let's go and check the website. For now, you have to start with check the website for ADC. It's too hard to give you a plan right now for you to how to start ADC. So please let's go to the website, which is ADC. I think it's www.adc.org.au. I believe so. And all the best for you, Leith. Irfan asking, how can we improve communication skills? Communication skills, actually, it's something I would say it's more genetic and inherent in you as a person. So if you have it from the beginning, that's make it easy for you. But if you don't have it, so you need to read more. You need to read again, mostly Australian sources, based sources materials. You need to go with ADA. You need to listen, for example, like if you go to radio, I think there is ABC. They have some channels for you, so you can go and listen to the communication between doctor and the patient, or dentist and patient. You're gonna learn how to initiate and how to formulate a proper communication with the patient. So there is other channels, something called health. I can't remember health. Honestly, there is more chance as well. I believe. I cannot remember, but one has a heart shape in it. I can't remember, but it has a heart shape. I like this one. So always there's a communication between the doctors and the patient, or maybe dentist and patient. So, but try please go more with whatever Australian, not another country. Okay. Let me go scroll down a little bit because I can't see questions I haven't answered. Oh, Shahana. Shahana, she asking, they provide fascia sealant. What do you think it is for? Definitely, if they provide fascia sealant, so it could be one of the OSCE station. The things was the 6 of the clinical treatment and evaluation. So I believe fascia sealant could be mainly one of the tasks comes in the OSCE station. Management cases in clinical, do you think they will actually have to do fascia sealant? Yeah, they do. Is pass grade means satisfactory or borderline? As we have explained before, it's not only, I don't know which one you're asking for. Are you asking for clinical or are you asking for technical? But for clinical, not only one is going to be just a pass. Like if failed, it's mean failed, and that's it. Borderline is still pass by itself, but they need to collect, they need to add the 2 clinical information gathering, the 2 as one OSCE, and then the 2 diagnosis and the management planning as one OSCE as well, and then 6 clinical treatment and evaluation as one OSCE too. So every one of them is gonna be like only one OSCE, and then whatever grade you get, like maybe if you get borderline you consider as pass. But for example, if you got 2 borderline, I would say you may fail. I'm not quite sure, because if you go and check another criteria, you will find some people they got 22 and they pass, and some people got 20. Actually, some people got 20 and they pass, and some people got 22 and they fail. Again, it's a quota. The highest, like for example, I'm just giving all of this example, like if you are 10 people and they only want to choose only 4 of you. So if the 10 of you get, let's say, get about between 20 or 22, like, or actually 10 of you, 4 of you got about 22, and 4, or actually 6 got 20, the 22 people the people got 22, they're gonna pass. The 4 people got 22, they're gonna pass. And the 6 people got 20, they're gonna fail. Okay, let's do another example. They want 4 people pass the exam. So if these 4 people got 20, they're gonna pass. If the rest of the people, the 6 people get less than 20, they get 18 for example, or go maybe 16. So this is gonna fail, which is people get 16, but the 4 people get 20, they're gonna pass. So again, who's the highest and how many they need? They have mentioned adhesive in the handbook. Is it the same as bond? Definitely as it is. No, adhesive is going to be a bond. Okay. I'm just scrolling down. Sure guys, just trying to get the whatever I can see important questions. Okay. Sorry guys. There's from Shri, they ask them X-ray folders. I don't know really what does it mean by X-ray folders. Maybe holders. It could be the X-ray holders itself. Guys, X-ray holders actually, it's I don't know why you're scared when using different type of X-rays holders. Because finally it's the same. What you need to do only is just the ring itself. Just be sure it's covering the film, the bite block, or the film holder itself. If it covers, it means like it's fine. So if you're in doubt, like care system, it's like a ring system, so it's all the same. If you are in doubt, you just only go and try to read, Google it, and try to see what's the difference. But definitely there is no difference between any systems and each others. Go just read about them. It's the same ideas for every of the X-ray holders. Honestly, Tanjum, I don't know what does it mean by explain borderline regression. Is it regression something about perio or borderline? You mean for assessment? Yes, questions like the I can see someone asking why they not really mention anything about the bay setup, and I believe actually they can tell you in details, more details and orientation there about the bay setup, because you cannot start exam without bay setup anyway. However, with 24 people, I think it's very easy to set up everything for you, and they let you know about it, like what exactly you need to do. But it's still, like for an orientation, they should really tell you like what you need to do, including the base setup. Oh, Dr. Shuwade, can you please give a brief idea about Caries risk assessment? That's really like it needs a day as well. It's really going to be too much. There is one article, it's EVAN article. EVAN article, I think one of the most important articles in Australia. They really trust it very much, EVAN article. So go up please and read it. It's going to help you. While taking history, do we need to make any sequence, or can we go in any order? Actually, no. When you take in history, there is actually a format, and this should be in order. Then, like, if I'm taking a history now, number one, chief complaint. I cannot see the patient's first time and then just say hi to him, and then after this I tell him, okay, let me just check your medical history right now. So the patient like gonna look at you like, what are you talking about now? My tooth hurts. You need to ask him about my tooth first. So definitely you're gonna go with the chief complaint first, and then you need to go with medical history, and then the past dental history, the past and current dental history, and then go on and just keep going the same way until you reach your diagnosis. So yes, it should be in order. And mostly when you have the dental history, you need to ask questions. It's more related to the chief complaint. So if the patient comes with a sore tooth, and then you're asking him about, oh, look, do you have let's say discoloration? So if you're asking him a question about the discoloration, it's not his. Actually, it's not his. The main reason he attended the clinic today or visited the clinic today just for the discoloration. So you mainly need to direct your question into the chief complaint. So try as much as you can get question into chief complaint to reach the proper diagnosis of the current condition right now. So that's going to be your questions even about the history. So once you, like, even you cannot ask him, for example, like if he comes with, let's say, severe pain, very severe pain of tooth number 16, you cannot ask him about, let's say, perio case now, because it's not a perio case. Seems like it's very severe pain, and if you hate from the signs symptoms more about palpal pain, so try to direct all information into palpal pain. Otherwise, if you keep asking in perio case and then you take it to ortho case and then take it to any other branch of dentistry, you end up with no diagnosis. So try to listen to the chief complaint, try to listen whatever information give it to you, and then try to gather this information to reach up into only one possible diagnosis. And your questions even need to be in the same way of this type of chief complaint. Otherwise, you're gonna miss the whole scenario then. Okay guys, just I'm going through the questions. About the orientation day, it's first day for you for the exam. They must give you orientation. They cannot get you from outside the room and then telling you to have a seat or have a chair. So you need to get orientation about it, which is going to be the first day of the exam. Okay guys, I think only 10 minutes left because we started at 9 o'clock, I believe. So maybe we can answer only like 2-3 questions from now, and that's it. Okay guys, please if you have any question, just I'm trying to scroll up now to see if I haven't answered any question. Samir asking about, could you please advise about medical emergency topics? Medical emergency could be health related emergency topic, it could be dental related emergency topic. It could be happen outside your clinic, it could be happen inside the clinic when you do the treatment. So I've given you just a quick example of each. So dental cases, emergency cases happen dentally and outside the clinic. I would say a patient comes with a vulgar, for example, trauma, was playing outside in school somewhere else, maybe he was swimming in swimming pool, and then he comes with a vulgar. So in this case, that is emergency, which is happening outside the clinic, and it's more dental related, not medical health related. A case which could be a medical health related, it even doesn't happen in your clinic, which is a patient, for example, he has, let's say, heart condition, and he has previous history of heart failure, and while he was waiting outside, he got stressed while even didn't see you yet, and then now the trouble started outside the treating room. So you need to deal with this type of patient. Let's say this patient now came to your clinic right now and is treating, and in treating room sitting on your dental chair, and then while you're talking to him, he just fainted and he lost his consciousness. in this case, it's a medical condition. It happens inside your clinic, treating room. So mainly, it could be a condition related more to the teeth, like dental condition, could be medical condition. I would say in Australia here they care more about loss of consciousness patient. So try to read more about loss of consciousness. Like what you need to do if the patient fainted. Okay. Shri asking about my advice regarding our last minute. No, Samir. Your advice regarding our last minute preparation. Guys, your last minute preparation, again, it's all about your control, your stress control. You need to control your stress right now. You need really to have equal attention to technical and OSCE. For OSCEs, when you prepare for OSCEs, read whatever it's more clinical information. Don't read something which is more theoretical. Read whatever Australian-based sources, like a journal or articles. Try to read whatever it's more common daily procedures and treatment in your clinic. I would say like scaling cases, perio cases, extraction cases, caries management cases, taking an X-rays, place rubber dams, RPD designs. As I said, emergency case, I would say a Valgen could be one of them, like trauma. It could be a patient who was in your clinic and then he fainted. Medically compromised patient, how to deal with these patients, and taken history. Guys, very important. Management and taken history and the communication, very important. Like it's like two clinical information gathering and diagnosis and management planning. So four stations, they have communication in it. 4 stations, or actually the 10 stations, they have infection control. So infection control is very important. Communication is very important, including gather information and diagnosis, how to do diagnosis. Clinical treatment cases and evaluation, as I said, it could be anesthetic, could be perio case, do scaling and charting, rubber dam, X-rays, extraction, fissure sealant. They may give you some tools or instruments to identify some of them. They may ask you to mix something, like to mix, for example, calcium, let's say GIC, powder liquid. However, we don't use it in Australia that much, but they may ask you any of these things, which is everyday clinical tasks. I don't think they're gonna ask you about something which is, again, as said, like it's more special, especially in case of ortho. For ortho, they may ask you about diagnosis only, like to get an X-ray and then diagnose the X-ray, diagnose the patient, like which class it is, what you need to tell the patient, what the patient may expect from the specialist, from the orthodontist. So only gonna be basic stuff, not be very hard stuff. They may give you some patient with complications, like they have made a complete denture recently and then the complete denture has some complications, so you need to work on it. You need to find what could be the reason of the complications and how to fix it. So again, it's every day. It will not be something, I would say, I don't expect at all, like 8 out of 10, I don't think there is any surprise. Maybe surprise only for 1 or 2 tasks mainly. But again, it's equilibrium. You have equal information. Every one of you have equal information. You are now all equal. None of you knows the questions before. So it's gonna be surprise. If any surprise, it's gonna be a surprise for all of you, not only one or two. Like all of you are gonna be surprised if something happened, but I don't think there's gonna be a big surprise with the ADC. For infection control, please read the ADA infection control guidelines. Do you think they will ask us to take an impression? That's gonna be very messy. Why not? But it's gonna be very messy. They may ask you to take an impression, but I don't think they're gonna judge about the quality of impression. They may judge more about like you as administrator, how you take an impression. So your movement mainly, your action, your position, the patient position. That's mainly they can check. Okay, guys, it's again, what is the risk profile of patients? Risk profile, actually, it is the, let's say, if a patient who has multiple caries, lesions. So this patient, I would say, it has high caries risk now. So we need to find out why this patient actually got this high caries risk. So we need to have a risk profile for it. It could be because he's on medication recently, maybe he's under stress recently, maybe he's smoking now more than before, he's drinking now more than before. So we need to find any risk factors. So we need to take a profile of it and how to manage this. What's the best way to manage it? Do you think they can get sphalometric analysis? Yes, definitely. They can give you sphalometric analysis. It's for ortho diagnosis, I would say yes. Just only to analyze which class it is, because that is one of your job. Guys, as a general dentist here in Australia, you need really to know what is your responsibility. Like, is it my responsibility to do stitch? Yes. Is it my responsibility to do biopsy? Yes. Is it my responsibility as a general dentist to do surgical impaction? No. Is it my responsibility to refer patient with a good referral letter? Yes. To do prescription? Yes. So this is your responsibility, guys. So you need to understand what is your responsibility, and that's going to be your exam tasks. So to do analysis for sphalometric, yes, that's a part of your responsibility, because you need to get a proper diagnosis. Because you will, when you send the patient to the orthodontist, you need to say that is the diagnosis of my patient. And then after this, when you send him the X-ray and stuff, he's going to have his own diagnosis. But at least he needs to know, like, initially what sort of patient you refer, which class it is. And even for the patient himself, because the patient needs to get like explanation about what could be the expected treatment. Okay, guys, Facebook, yes, as well. You need to read about Facebook. Okay, guys, now I think it's 9 o'clock, 9 or 10? 10 o'clock, I believe. I think that is enough for now, guys. I don't know really what to expect. Like, if you have any more questions, guys, I may try to do another session before the exam, maybe next week or week after, especially for July people. But believe me, like for today, it's like 1 hour is enough for me. And I appreciate your understanding. And maybe I see you then next time. It could be next week or week after, just before July. If you have any question, we can go with, again, either Zoom session or Facebook Live. It's too hard honestly to do Facebook Live. I prefer Zoom session, but the problem with Zoom session is I cannot include everyone, and I feel like guilty honestly when like I try to include everyone in the session, but I cannot. Okay guys, thank you very much for every one of you. I wish you all the best for your exam, and I may try to make another session if I can next time, but please make the question ready and everything ready so it will not take like long time, because it's gonna be again 1 hour only. And I'm really very happy when I see you like at least like get a little bit confident about your exam with less confusion. Okay guys, so now we're gonna now shut down the video. Okay guys, thank you everyone, and have a great day. Actually it should be night now. Thank you. Bye. Beautiful.